World first private website to fight against COVID-19. COVID-19 has spread to nearly every country in the world since it first emerged in Wuhan, China. More than 7 million are known to be infected and nearly 0.4 million deaths have been recorded. COVID-19 has shattered the whole world by affecting more than 4 million people all over the world. All we have to do is to break the chain and stay safe. Let us understand the spread of COVID-19 with an example. How a grocery shop spreads virus to the whole locality. Essential items groceries gets unloaded from a truck. The labor touches all the sacks in the truck. Sacks gets contaminated along with the helper. 3 people from the shop come in contact with all the sacks and one of them sneezes and thus contaminating the person at the counter. People who visits the grocery shop get infected with the virus. In a single day, this affects at least 20 people with lesser immunity power. Out of these, 2 people identify the symptoms and reach the clinic and hospital respectively. One of the doctor and the compounder gets infected along with one of the patient in the queue. This gives rise to community spread in that locality. Many people are taking extra precautions to avoid COVID-19. 6 feet is generally the length a droplet, from a cough or sneeze, can travel from person to person. Social distancing can be beneficial during any cold and flu season but is especially important when there's community spread of an illness. Skipping handshakes and hugs can also reduce virus spread. People should avoid touching their faces too. Washing hands with soap and water, for at least 20 seconds, is important. The best way to prevent COVID-19 infection is by frequently washing your hands, using hand sanitizer and distancing yourself from others. Now let us move to recognize day-to-day signs and symptoms of coronavirus. The beginning symptoms are similar to the common cold with a mild sore throat, neither having a fever nor feeling tired. The patient's throats start to feel a bit painful. Body temperature reads at around 36.5 degrees Celsius. The patients that haven't started recovering by day 7 get more serious coughs and breathing. Fever can get higher up to 38 degrees Celsius. Patients may develop further headache and body pain or worsening diarrhea if there's any. Many patients are admitted to the hospital at this stage. Severe shortness of breath becomes more frequent. Temperature reading goes well above 38. Patients are having loss of appetite and may be facing abdominal pain. The condition also needs immediate treatment in ICU. Let us move toward busting common COVID-19 myths. Have you heard that eating garlic prevents COVID-19 infection? Or that taking a hot bath will protect someone from the novel coronavirus? People are thinking hot air kills this virus and using blow dryers or somehow increasing the room temperature will help prevent the spread. That will not happen. And don't think hot humid climates are protective. Some people believe mosquitoes can spread the virus, but that's not the case. Mosquitoes can transmit disease only by sucking your blood and transferring that blood into someone else. But this virus doesn't stay in your blood very long. From the early stages of the coronavirus outbreak, conspiracy theories about the origin and scale of the disease were spread on online platforms. Among these were the false claim that the virus was part of a Chinese covert biological weapons program, and a baseless claim that a Canadian Chinese spy team had sent coronavirus to Wuhan. And months into the outbreak, not only have these theories not faded away, but new, unverified claims have been promoted by government officials, senior politicians and media outlets in China and the US. Zhao Lijia, a Chinese foreign ministry spokesman, has repeatedly promoted the idea, without evidence, that COVID-19 might have originated in the US. On the 12th of March, he said in a tweet that it might have been the US Army that brought the virus to Wuhan. A day later, he tweeted an article by the website Global Research headlined "Further Evidence That the Virus Originated in the US," and urged users to read and share it. The article has since been deleted. Chinese daily The Global Times echoed Mr. Zhao's sentiment. COVID-19 had undeniable and horrific consequences on people's life and economy. With sickness, death and unemployment rates soaring almost everywhere on our planet, it is easy to despair. Notwithstanding the gruesomeness of this situation, there are some outcomes that could have a long-term positive impact on the planet and humanity.